This program is rated PG. Parental guidance is advised.
Ask Your Pharmacist is brought to you by Dragnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, and proudly sponsored by Lita Pharmaceuticals, quality healthcare, with support from VitC-Fort, your best vitamin C plus zinc supplement from Samus Pharma.
Good day, everybody. I am always happy to come your way with another exciting episode of Ask Your Pharmacist. My name is Peggy Sano. Follow me on Instagram at FieryPeggy. This show is proudly brought to you by Dragnet, your #1 online pharmacy. Download the Dragnet app on Google Play Store or the App Store. Order all your medication, speak to a pharmacist, and have it delivered to you wherever you are. We're Dragnet, what's your boku, what's your novrungo, wali baby, what's your bia, what they drone out on Sabeka. Dragnet, your #1 online pharmacy. This show is also brought to you by the Pharmaceutical Society of Ghana, Amicus Humani Generis. Pharmacists are indeed the friend of the human race. This show is also brought to you by the Lady Pharmacists Association of Ghana and the Young Pharmacists Group. This show is proudly sponsored by Lita Pharmaceuticals. With Litamin multivitamin and minerals, this is definitely the right multivitamin you need to start your day right. It supports your physical performance, boosts immunity, and supports mental performance. And with Folarin Zinc, it has folic acid, and it's also an iron supplement, and it's for your health and wellness. And with Litamox, it's a dewormer for the family, and it helps treat intestinal worm infections. These are all available in any pharmacy near you. This show is also supported by VitC-Fort, the best vitamin C plus zinc from Samus Pharma, and it's also sugar-free. Please contact them on 050-164-6494. We are going on a quick break. The show continues. Don't go anywhere. We'll be right back.
Net, your #1 online pharmacy.
Beautiful, like a rainbow.
Thank you so much for staying tuned. You are watching Ask Your Pharmacist. Matter of fact, the next 2 episodes we are focusing on women's health. I know you love the sound of that. So the Women's Health series is proudly brought to you by the Lady Pharmacists Association of Ghana, LEPAG, and the Ginsomin Eve. For women, please get yourself Ginsomin Eve to help nourish your skin. It also has Korean ginseng and every other nutrient required for a woman to deal with your stress. Today, we are coming to you from Agbogba here in the Greater Accra region of Ghana. And our guest pharmacist is Farm Stella Kranti Asante. She is a CEO of Bridgeview Pharmacy at Tantra Hill Runabout in Accra. And of course, she's a member of LEPAC. And our topic for discussion is Vaginal Care. Farm, how are you?
I'm good. Yourself?
I'm doing very well. I mean, I see you all jittery and excited. I'm getting excited too. All right, so today we are talking about vaginal care. Why do we need to understand or know more about this delicate topic?
Well, thank you very much. When it comes to vaginal health, I would say it's one of the important parts of women's overall health. It's not just for delivery, but it also have a lot of exciting things about sexual desires and orgasm and other things. So it's very important we know, and it affects our fertility as well. So to me, it's a very important topic that we don't have to downplay. You are welcome to the show, madam. Please, I want to find out, is there anything you want to know about vaginal care? Anything you want to ask the pharmacist?
Sure. I would like to ask, what are the things we need to do as a woman or a lady to keep your vagina tight?
Oh my God. All right. Thank you for the question. What I would say is I always believe in natural, right? So the first thing I would advise is that there is this exercise called Kegel exercise. It's one exercise that is really recommended that helps tighten the vagina. Here, what they do is that it will be like if you are urinating. So you just hold on the urine a bit and then you release it. When you do this, it naturally tightens the walls of the vagina. I know there's been instances where people use medication to insert in their vagina. I would say that it's not very advisable because it tends to distort the natural flora, the pH of the vaginal region and the rest. But in a situation whereby you go through the Kegel and it's not working, you can still talk to your pharmacist and you can get a solution. Thank you. Any question for the pharmacist?
Yes, definitely. My question is about discharges. You see, women, we normally see discharges every day. I wanted to know if there is any particular thing about it that probably it should raise concerns for us that we should be worried about.
Okay, so what I would say is that your vagina is not dry. The vagina naturally has its own discharge. Depending on the time of the month, whether you are about to menstruate, whether you are finished menstruating, whether you are ovulating, there is always a discharge in your vagina. The issue is the consistency, the rate at which it comes out, the color and the smell is what will let you be of concern. So in a situation whereby the color has changed, it smells, it itches, then it's concern. Other than that, there are some, especially when you're about to menstruate or just after menstruating, you see that the discharge might be white, it might be slimy. If you're about to ovulate, it's a bit slimy. So for that one, it is natural. If it doesn't smell, if you don't itch, there is no excessive discharge, the color hasn't changed, then there's nothing wrong with you.
Okay, thank you very much for clearing any misunderstanding.
So me pacho who question me abese umbusa pharmacist nana.
My questions na also, but mele me tell me how to just one. Says ya no, nyama bebre aba sister ma emma enya a lot of discharges. Oh, master omu nyina classify as candidiasis. Me so me say o yare bia generally yourself friend UTI, urinary tract infection. Tisa omu nyina friend candidiasis no. Education based and the more mama say we nya candidiasis we is saying. They told me no. Omanu mundra ono menene ko within a week time na asaba. Was anu maduna ko within 2 weeks time na asaba ntebasa na. Is there any permanent solution between them or man? E must have problem we in face be man. I say be I am man so. You call my anybody come.
Uncle person ninja. And no na em say motor friend no ode poano. But me pacho, the tiene say emma nyame abo ye yase very natural. Etre say abri nyina no ye wo nsuo bi a ewo yase. Yase nye dry. Eni kwan so oba wase eye dry. Na ya na ye niminti no, ya na ye dwen say bibi egu ye nya. Etre say bia ye odepoa. The thing is say ye menstruate ewie a ye wo nsuo ewo yase. Ansa ne be menstruate say wo nsuo ewo yase. E na se ye tunkosi anso ye wo nsuo ewo yase. Inti no de ye kan say e wo so oba bia ontimi ehu time a ewo wo busu minim eni nsuo kura egu no. But say eba say nsuo na egu no say ebon say eba bebre na egu ne panty mu anase asesa kala enu na eye concern anase na sekeka na enu ne ana ema ewo say enye dadwen nti be say say obi beka say bia eba ye no me fa eduro enso asaba biem na enye bia yare no yare onya edue poa but eye nyame abode na wobo nsuo no na se no ene wo ho ba because onim sa nim die nti no eye ne say oyare. It is so oba bi sana so oba bi tie yenya se eba se ohombon enkeka ensesa kala anase engu dross mu bebre a enya hwe sana nyame ebo no me ba cho uyo okay
Ba we de me okay Matias nti say the all Chinese says me hu say nsuo bi o me dofo no ase a enye ni nyina na wo say me ma me concern come no especially say embon de a me okay but time a me hu say bi ascent kakra wo mu no ena eye time e say me ma me concern e ko na me hu de me ya fa won
sa pepe.
Is it when a woman is in her period, is it safe for a man to sort of go on road?
Okay, so I think what Daddy wants to find out is if a woman is menstruating, is it safe to have sex with a woman? Daddy, what I'll say is that, first of all, when a woman is menstruating, the place is not very neat. And we will prefer that you allow the place to be very neat. Other than that, there is prone to infection. Because the blood is there, there's possibility that there can be an infection. So it's always good to let the place be safe. But if you can't stand, then you can use a protective rubber, like a condom. Thank you.
A lot of men don't really care. Because when they are in the mood, they don't care whether, they don't really, it's not so much of an issue to them. No, we have a lot of men like that. So I think it's important, whether it's healthy, and actually women too don't like it, especially our women, they don't like that. But
It's true. It makes us feel very uncomfortable. And you also saw the bed too. So it's just between 3 to 5 days. So men can wait so that the women finish. The place becomes very neat and you can go on road to enjoy it. That we are very grateful for coming on the show. Thank you.
So let's talk about how do we care for the vagina.
Well, when it comes to the vagina, because of its because it's a very delicate organ, there's a whole lot of things that we need to consider when we want to care about it. There's some do's and don'ts with care of the vagina.
All right, so walk me through the do's, then we'll talk about the don'ts.
All right, so with the do's, what I'll say is that it's one organ that you have to make sure that you really take care of it, especially in the way you wash it, whether you've even given birth, how you care about it, the kind of undies you should even wear, and how you should even...
Hey, what kind of undies do we have to wear?
Oh, well, what I'll say is that as ladies, you need to make sure that the panty you go in for are cotton, so that it can help absorb moisture to prevent you from getting infection. And also, you should make sure every now and then you are wearing panty, not to go and to pee.
Because I do hear people saying that not wearing pants is good because, you know, this part of the world is very hot and they feel like not wearing an underwear is like the best way to go. What do you have to say about that?
Well, to me, I would say the best time not to wear panties is when you are going to sleep. But during the day, it's always good to be in panty, especially cotton panty. And with our ladies who tend to just slip in their trousers without wearing, we have to realize that your trousers cannot really absorb the moisture. And especially when you finish weeing, the excess urine will be in your trousers. And some people will tend to repeat those trousers. So they are prone to getting infections. So it's best to always wear your panty. It will breathe.
Okay, so talking about the do's, you know, I did, of course, a lot of people would say that do not wash, you know, that part of the body with soap. What is your take on that?
Well, Peggy, I will tell you something. When it comes to the anatomy of the vagina, right, we have the external layer, where we call the labia majora and the manoria, before it gets to the vaginal canal itself. That external layer, it tends to accumulate a lot of dirt and sweat. So for that bit, you can decide to go in for a very mild soap with a good pH to wash that external layer. They're not washing, we talk more of the internal, where people tend to, you know, indulge in the habit of putting their fingers in the vagina to scoop everything out. That is what we say, no, no, no. But when it comes to the external, that is where it tends to have a lot of the problems. So for that place, you can wash it a lot with more water and a very soft or maybe mild soap with good pH to wash that place.
All right, so we're still talking about the do's, okay? What is the one trick that you would give when washing your vagina or vajayjay? Because, I mean, some of us might be probably washing it wrong. What would be the trick you would want to give to us?
Okay, to me, I'll say more water, more water, more water. It's always good that as a lady, you try and bend down so that there can be good opening of the vagina, and then you use your left fingers to wash there very well, not to do an insertion, but just at the tip to make sure that the external layer is very clean. So more water at the external layer. And also when you visit the washroom, you also try to use a tissue to mop up excess urine. And when you also visit the toilets and you are cleaning, make sure you clean rightly from the front to the back.
Say that again.
From the front to the back, you know, so that it doesn't... Peggy, you know, especially when you look at, once again, the anatomy of the vagina, even from where we're from, and I'm sure lots of ladies don't even know where their urinary canal is. It's very tiny round hole just above the vaginal canal. So possibility that the organism will move from the feces to that region is high. So if you don't take care, you have frequent infection. So it's good to always do that.
Okay, well, let's talk about the don'ts. I'm really excited about this part.
All right. So with the don'ts, first of all, we say that you should not insert your hands in your vagina to scoop the things out. That is how God made us. If you even scoop everything out in the morning, by the time you come in the evening, there's another set there. It's there to protect us. And also we need to prevent inserting things that are not recommended by doctors or prescribed by doctors into a vagina. Some people will say that they want their vagina to be tightened. Some people will say that, oh, I want that place to be, more watery. I tell you. So it's a very bad habit. We have to just keep that place safe. It's a very delicate organ which is needed by us. So thereby we need to keep it very safe.
Okay, wow, I'm very excited about this. And very briefly, okay, so I want us to talk about the types of discharges. Once Obana himfune, senior maybe a cohon, but so Babeka soya repa usually it deals with infection. So let's talk about the types of infection. First, let's do the healthy discharges first.
All right, thank you for starting with the healthy discharges because, like I said earlier on, there is no vagina that is dry. God made it in such a way that you always have fluid in your vagina. So as a lady or as a female, you just have to know the state of your vaginal discharge, the color, the consistency. When you're about to menstruate, there is a difference in the discharge. When you finish menstruation, that is different. When you are ovulating, that is different. So all those things, it doesn't mean you are sick. So sometimes you can see some whitish discharge. If it doesn't come excessively, definitely it will be there, but it doesn't mean you are sick. So those are some are thick, some are slimy, and it's normal. It's very natural.
All right, so I would want us to talk about the types of the discharges, the colors, the texture. But let's take a quick break. We'll come back and definitely delve more into this. Don't go anywhere.
Net, your number one online pharmacy.
Beautiful, like a rainbow.
Thank you so much for sticking with us. You are watching Ask Your Pharmacist. We are still discussing vaginal care. And before we go into our discussion, I definitely would love to recommend Ginsomin Eve to you. It has essential vitamins and minerals for our ladies. So if you need to get healthy, stay strong, get the whole place looking all good up, please go to any pharmacy. This is how it looks. And make sure you tell the pharmacist that you want Ginsomin Eve, and they will get it to you. So let's talk about infections. What are the most common infections that happens with our VJJ? Pressure. It's infection pana your boba
So I think I'll generalize it to say vaginitis. Vaginitis is more broad than make us say odepoa. And what I would say is that for the vaginitis, the concentration can be on one, bacterial vaginosis. For the bacterial vaginosis, it tends to have this fishy smell. And no color, no mostly yellow. And then we have the trichomoniasis, and only a more fungal. And I saw candidiasis. The obia say odepoa, and I say candidiasis white. But I bring you now, and yet discharge na a year odepoa. Based on that, say color ni yellow, say ye brown, say ye cream, even texture na cry, say a bubo to say be a milk. I say milk, say I won't say a bubo pono, and I say a ye tinko and a ye lampa, depending on organism air course, any texture a beba, and a quantity na esa e guno. Most of the time for bacteria is no most a bumper, what is a fish? A bee was very foul smell. Into no son, never yet me say no. Would ye the enya candidiasis? A be a bacterial vaginosis and trichomonas. Na a boy, na ya select particular medication na ye the amount.
Intimitiasia ya enye discharge ni na oba de bibi gu ni kakra no so we de e poa wo hu. Inti ebi wo hono ma depending on say na abobo su e na obehu treatment obema, because there are instances where a lot of women are like treating for certain kind of discharges and on make us my yesa enko. Into what kind of treatment as a pharmacist no maybe pharmacy say na make us insure be a free my himfia na ma say ba questions when you dey na be ma me hu say no we dey enye e dey poa
yo and see there you be first na say first of all insure na egu no et sen e color ben e keka wana egu pantin bebra na ne smell so et sen it's no information a odi be ma ye no e na betimi aboa yen amayaka say bi a we de enye odepoa na yesi na ya boan most of the time no depending on the presentation yet ama e dry bi ade be hye wase ni asama e dry obenom
nti no ade nti de ndro ni bi wo ho no ma meka sa fa hye wase na e bi wo ho sa be ka sa take it orally.
All right, so what I also say is that most of the time when it comes to vaginitis, the topical medication tends to work better because the organism mostly are found at the topical layer. So when you insert the medication, there is a direct contact of the medicine with it. And then the oral one will also go into the blood and tackle whatever organism that is causing it. And if you walk around now, I can't know, you other party too. Mrs. It's make a kawa, what it's here, Ede, we have been out show. No, I crow. It is announced here what creamer. Yet the mouth now, so they are found when I say cacao monster, you will draw your timid mouth now. I prevent itching. It's depending on presentation or your mouth, your best show, your summer, your benum. Now it's mean a holistic treatment. Now, want to.
Intendian patchot, meant nephew and casse near Eguni Edepua. You can't just have a one treatment to the kind of discharge or the kind of symptoms you experience, and always make sure you're talking to your pharmacist. Like our pharmacist rightly said, there are different kind of infections that happen down there, and to make sure you're getting the right treatment, only a pharmacist can help you with the right treatment. This is an eye-opener because there are so many things that I feel like I didn't know and I'm really learning. But let's talk about diet.
Peggy, healthy living always goes with eating right. Okay. So what our advice is that as a woman, you have to make sure that there is balance in your meal. You try and eat your fruits, your vegetables. You try get more greens into your food, and just try to keep safe. You can also go in for
you know what that is exactly for your stress, yes, and for general health.
Yeah, okay. So that's what I say. Just try and eat healthy.
Okay. Well, I love the sound of that. This is so educating. So, Fam, what are your final words? And I would like you to also tap into a little bit tricks. I love like some tricks that women can do, because I think a lot of our viewers would want to be doing something differently to help, with their vaginal care.
All right. So, first of all, I'll say that as a woman, you concentrate on the vagina. Know that it's one of the delicate organs that God created. Apart from just our sexual pleasure, it has a whole lot that it does for us. So first of all, try to keep it safe. Try to keep it healthy. Wash your vagina very well. Try and seek your pharmacist's opinion when you are seeing any changes in your vaginal region. The way you wash your pants, you should take care of it. Don't wash your pants, hang it in the bathroom and rewear it again. Make sure that your pants are soaked in a detergent. You wash it very well. You hang it in the sun. Try and let your system know that you care about it. You care about your vagina. Wash it very well. Try the casual exercise, especially those who have delivered. If you feel your vagina is so loosened and you want it to tighten, just try the casual exercise. It will help tighten your vagina for you very well. And try to avoid every type of insertion. Don't just go in for any insertion. And even sometimes when the vagina is extremely tightened, you tend to hurt it. Because when you are having sex and the place is not so wet, you end up getting bruises. And that one even prones you to getting infection. So no need for so much tightening. It's not very necessary. It's about enjoying the sex with the right person, I would say.
Okay, with the tightening, quick question though. I mean, a lot of pregnant, mothers after delivery, almost so tight hormone, and also.
Peggy, I'm going to create me. No, dear, and you're very advisable. In say, Obetina is so minimum be a what's now so grandma, Ashen the Tunina, and you're necessary. Naku point in its own way. Ewa Quanya, Otimi, a repair son, and sometimes who will so your mouth antibiotics, your offer vitamins. It's in a no crowd, boy, Emma. Ohona ebi abeka sa ye kuro kakra because akra ni few oba ye no asa akọ back to the shape, but Yakupon na in ne own way no ohona besa achi e na te say dem kan casual exercise no eno no ubetimi aye bu wi a utimi ye eno na te say wo junso asa junso ne ba no na weja kakra na wachim kakra na weja ne kakra na wachim kakra nti eno no say wuti wo kra wo breastfeed akra ne kra na wo chim na wo ye na wo chim ema walls na e wo vagina ni mu no muscles na e strong. It's by 6 weeks after delivery now bon say vagina no back in shape.
This has been very educating. I mean, I really hope our viewers did learn a lot. Of course, the vagina, I always say, is something that always gives up on you if you're not treating it right. And it will get you uncomfortable. So always make sure you're treating that place with care, with some love, and make sure that if you're not too sure, you can always ask your pharmacist. Thank you so much. Dose for Healthy Living is up next. Stay tuned. We'll be right back.
Today on Dose for Healthy Living, ask your pharmacist. Don't hesitate to ask your pharmacist questions if you have concerns about your medications. Remember, your pharmacist is your friend and an important resource for all medication-related questions and concerns.
Thank you for staying tuned and enjoying this didactic episode of Ask Your Pharmacist. Of course, I really did hope that you learned a thing or two, and that if you have any questions, please feel free to also reach us on our social media handles. Remember, this show was proudly brought to you by Dragnet, your #1 online pharmacy. Me part show bits me download the Dragnet app on the Google Play Store, the App Store. Baby, I wish ship yeah, Dragnet say the minute you call them, you have the chance to speak to a pharmacist, and they help you make sure that whatever thing that they recommend is the best for you. Dragnet, your #1 online pharmacy. This show was also brought to you by the Pharmaceutical Society of Ghana, Amicus Humani Generis. Pharmacists are indeed friends of the human race. And this is also brought to you by the Lady Pharmacists Association of Ghana, LEPAC, and the Young Pharmacists Group. This show was proudly sponsored by Lita Pharmaceuticals, Pacho, Litamin, a multivitamin, and a mineral supplement for you. It helps support physical performance, it boosts immunity, supports mental performance as well. Until person we are ding. Now we are nomi mesra baby I will be a pharmacy. Na kasa wope Litamin. Yes, also our following zinc. And also free Lita Pharmaceutical. It's a folic acid iron supplement. Into Pacho Pemoja. Now person we are ding dia. And also I definitely recommend for you. And Litamox is a dewormer for intestinal worm infection. These are all available in pharmacies near you. In Timpacho, so we here do one so bit me contact Lita Pharmaceuticals on the show ye. This show was also supported by VitC the best vitamin C plus zinc, and it's sugar free. So you can definitely take it no matter who you are, no matter your condition. It's healthy for you. I definitely recommend. Please, if you want bulk purchases, you can contact Samuel's Pharma on 050-164-6494. All right, you know, like I always say, I can go without this one. Whatever that goes inside of you is merely irreversible. More to the reason, you always, please ask your pharmacist if you are not too sure of your prescriptions of your medications. My name is Peggy Samuel. You can follow me on Instagram at Fiery Peggy. And until then, please be safe. I will see you same time next week. It's bye-bye for now.
Ask Your Pharmacist was brought to you by Dragnet, your #1 online pharmacy, and the Pharmaceutical Society of Ghana, and proudly sponsored by Lita Pharmaceuticals, Quality Healthcare, with support from VitC, your best vitamin C plus zinc supplement from Samuel's Pharma.